Okay, thank you guys. Thanks for coming for the picture, and thanks for coming to our all-staff meeting. So this year we're going to try it with just 2 instead of 3 during the day, so it's going to be more people at each one, but we're going to see how this goes.
Charlie, we can't hardly hear you back.
You can't hear me?
No, I'm deaf in one ear and can't hear out of the other, so speak up.
Okay, I'll speak up.
Thank you.
So we're going to try with 2 meetings instead of 3, and we're doing it every other month. Last year we did it every month, and that was because of the 12 core action values that we did. So we're going to go back to every other month, which we did previous. We'll see how that goes. If we need to have more meetings, we will. We're flexible. We'll change. And so I guess first thing we do is want to introduce new people. And Trevor, I'll turn that over to you. You've got that, but whoever's in the audience here, we need to ask that.
As I'm going through this, if you're here, just stand up so everybody can say hello to you. And we can welcome you.
Does he want this?
All right. Okay, so we have Randy Broyles. He's our new housekeeper for the environmental services. He worked here before and he decided to come back. So welcome Randy back. Chelsea Hyde, CNA at the Care Center. Jennifer Merritt, another who left and decided they liked it so much they wanted to come back and work as phlebotomist in the lab. Shaylisa Stolze, CNA at the Care Center. Jordan Mitchell, CNA at the Care Center. Is Jordan here? Shauna Clark, dietary. Sid Steed, maintenance. Did I see Steed? Yeah. He's, because it's from HR. His name's Cody, but he goes by Sid. Ashley Bowling, housekeeper and environmental services. All right, Ashley. Welcome. Jeremy Stewart. Micah Draney, RN in the OR. Lachelle Winters, CNA at the Care Center. Callie Nelson, CNA at the Care Center. Josh Weston, RN on Med Surg. Brittany Failer, environmental services housekeeper. Kanisha Stevens, housekeeper. Trent Peterson, business office. Alaska Sanchez, housekeeper. And that's it. So welcome these people and make them feel comfortable at Star Valley Medical Center.
So, Trevor, how many of these are repeat employees?
It looked like we had 3 of them in there.
That's awesome. People want to come back. I think that's very good. So.
Yeah.
Okay. We got exciting things to talk about, so I'm going to move on here. Department service projects. Do you guys raise your hands? Who knows what your department service project is for this year? Okay, so then raise your hands if you don't. Nobody. We got one back there that's brave. Okay. We need to work on the OR department then. Okay. Communication. So we're actually, I hope you guys are as excited about it as I am about doing service projects this year. I mean, it's a way to give back. It's something that we're gonna try. We're experimenting, but to give back to the community, and we're gonna be visible out in the community doing something that we should feel good about. And as you know, that we are actually, you're getting paid for some of those hours that you're going to be doing the projects. So that's how committed we are, that it's something good for the community of giving back. Some of the projects are even on campus here, but others are out in the community. So you will, in these meetings coming up, as you do your service projects, come back and give a report of what you learned, how it went, and so it'll be your opportunity to talk to us about how your projects went this year. So, any questions on service projects? And if you don't know what they are now, you need to talk to your department director, because they will know. Okay. Talked about all staff meetings, when they are this year. There's the dates. And now I'm going to turn it over to Mike, is going to talk about our exciting wellness program. Mike.
Charlie,
Yes.
I'm going to defer to Sarah and Matt. They're
Okay.
much lovelier than I am.
So who wants to talk?
They're going to make a presentation.
Very good. Good look for you.
Thank Chrissy. Letting me borrow her scarf. Who knows, I may never look back.
I know. It screams Chrissy. I knew right away it was yours. Okay, I'll try that probably. So, wellness. Can I see with a show of hands how many of you were a part of our previous wellness program? So, quite a few. I wasn't. I know. So with the support of our board and our administrative team, a small group of us have got together to try to reinvent the wellness program for SBMC, and we're getting ready to kick it off come February 1. So Matt and I are just here to share with you kind of what our team has been working on and the company we've chose with. And this is just a brief summary of kind of what we're doing, where we're going, and there will be more to come. So we've really tried to, as a group, work together and see where the initial wellness program succeeded and where it maybe had some shortcomings, so we could really reinvent it and make it a really great program that everyone wants to participate, whether their interest is, in the healthy eating or activity or mental health or whatever. You'll see like all of the different areas that this program is going to be targeting. So the company that we chose is called Comp Psych. It's a really amazing, a really amazing company. We're really excited that we found it. It's this just kind of tells about when it was found. It's one of the world's leading EAP, employee assistance programs. It has more than 23,000 organizations throughout the U.S. and 100 different countries. It's a lot of the companies that we looked at initially just focused on healthy eating and exercise, and that's kind of the foundation for a lot of them. And we knew that the initial program that we had kind of focused on that, and it wasn't as well-rounded as we wanted it to be. So this one, it really is well-rounded. It has legal, financial, work-life, wellness, all sorts of different services that we think will be a really good foundation. The program, or the company, has 24 hours a day service assistance from highly educated staff. They're always available, and it's a completely confidential program that we'll be using through them, so it won't be from our staff here.
So as you said, and just to reiterate it, we really liked this because the whole thing was based under a psychological program, and then the other things were added onto it. And so we feel like it's much more well-rounded. As we talked to the company themselves, they say that it can even become your homepage. And as you get more into it, it's not the most exciting looking homepage, but the wealth of information that is available in that homepage is, anything you want is on there. Whether it's, as it talks here, legal information, financial information. It talks about, on another slide, it talks about helping with shopping. So I don't know. It's got everything on there, and we're pretty excited about everything that's available. We've got a fair number of. As she said, with the different resources that are available with the EAP, it's all confidential. It's with their staff, not ours. And as it shows here, we all have the same exact link to the company. Whether you're the employee, the manager, the household member, which brings up another point. It will be. You want me to hold it? I shake too much. It will be available to your household members as well. So that's something neat that we can offer. we go directly to a toll-free line and then directly to these other places to help with any situation, whether it's health or whether it's a depression issue or really anything. Go to the next slide.
Yeah, so the bottom line just kind of breaks down all of the services, like the umbrellas that CompPsych will have to offer. So counseling services, work-life services, legal information, financial information, and then wellness services. So those are kind of the umbrellas of like different areas. Oh, thanks.
So just like the current EAP that we have, which we are switching, correct? That's changing
Yes,
completely
yeah.
to this. If some of you may or may not know, I didn't know it, that we have the ability to, and the resources that we get 5 sessions per person per calendar year on these different, some of these examples down here. So this is the company that we'll now be using for that program. Go to the next one. It's all you.
Sure. So all the different topics. This slide is just highlighting the use for legal services that they will assist us with. So I think this is something really interesting. Like I never would think a wellness program would assist you with legal help. So any type of family law, wills, bankruptcy, you can see all the things that are listed up there. So we'll have assistance with that 24/7. You can call and get help with any legal questions that you have. And it's really nice because they'll customize it to the region that we live in. So they'll look and say, okay, you wouldn't think that many people would know nationwide about Star Valley and all of the legal services that are here, but it's really good. They'll hone into the area that we live in and help you.
How in depth does this go? Will they help you make a will? Will they?
Yeah, so they have lawyers, attorneys, people right there that will help you. I'm pretty sure they'll help you do all of that.
And is there any cost to us?
I don't believe so.
No.
It does say discounted legal fees though.
It's
There-
30-minute.
So what they talked about in the meetings with CompPsych is that you get a 30-minute free legal session, and then anything after that, they have
then you get the discounted rates for it.
rates
So,
for doing these things.
you know, we're still kind of learning it too, and I'm not sure exactly what each of these things will be, but
Just to clarify though, on the EAP, in the past, we've been able to go over to like Rocky Mountain Behavioral Health, and that option is still gonna be available through this, so you'll call here, and then you'll visit with one of their specialists, and then they'll say, okay, well, we feel like maybe you need to go visit with somebody at Rocky Mountain EAP, or at the Behavioral Health, and then they'll refer you over there, and you get the 5 visits over there. And it's per person, per issue, so if you have a family member that's struggling with something, they can go over there and get their 5 visits. And in the past, with the EAP, we really didn't utilize it like we had hoped, so we hope that you'll share this with your family members, and because really this is a great way to have the overall wellness versus just, tracking your points and things like that as you exercise or calories or whatever. There's a lot more to wellness than just those 2 things, so.
they can use the online services though too, correct?
Yeah, there's
Yeah.
also online services, and there's nurse practitioners that are on the other end of the line that if you have questions, they can help with different things that come up as well. So there's just a whole myriad of services that are offered through it.
And so this is for our families?
Yeah.
Yes, employees, spouse or partner, dependents in the house.
Dependents in the house? Whether they're going to college or not?
Dependents in the house.
All right, Joel.
Does anybody else have any questions on that portion? Okay. Same thing kind of goes for the financial information and consultation. Again, they've got staff, financial experts available to either assist you or get you into contact with someone locally that can assist you with any type of financial assistance that you need. Work-life balance is the next category that CompPsych focuses on for things such as childcare, elder care, different programs that we have in the community that can help with those, event planning, community information, home improvements. You guys have any questions on that? And as you get access to their website, you can really get on and play in these different areas, and you'll be surprised how many resources it has and pulls up from our community.
It looks like Joel's trying to rush us through here. We know we're limited on time, so if you can go back one. Stay there for 1 second. Come on. So, our whole thing here. This goes over a few other health risk assessments that we're looking at. And that very bottom one it talked about incentive tracking, employees only, but we can track our wellness through this whole thing. Next slide. Just by a show of hands, who'd like to make $50 in an hour? Come on, there's got to be more than that, right? Okay, so the hospital really wants to invest in us. And there's a couple of different things, the different levels. If you notice, they're the same as our donation names. We, at each level, will, for these first two levels, which we'll go into more at a big wellness bash that we are going to have in the next week or so, we'll go into more how you achieve those levels. But the first two things, $25 for each one, for each employee, correct, Mike?
Yes.
And they're very easy. They're things that we already did. One is a health assessment where you go online and fill it all out. The next one's a biometric screening, which most of us already do with the free blood draw, and then a few extra things that will be provided. And then the next things we'll talk about it. So these things are the raffles that we get into as we get each level, and we'll talk a lot more about that at the Wellness Bash.
So Healthy Trails is going to be the name of our SVMC's wellness program. And then we're going to have the incentives are just different activities that we can participate throughout the year. We really just want this year to be, and really just get employees excited to participate in the program. And the incentives will kind of take you throughout the year, have different events or things that you can participate in, like Matt was saying, or different activities throughout the year that if you participate in them, you'll get some type of incentive for participating. These are some of the incentives that we'll have. Some really generous gifts, I think. And you guys have any questions on that? Does that make sense?
I just want to be real clear about something here. Thank you. So we have 5 different levels, and it's really based on a point system. So if you get your first 25 points is tied to your health risk assessment. So if you accomplish your health risk assessment before a certain date, which I think is March 31st, you can get a $25 cash incentive in your paycheck for having accomplished that health risk assessment. Then there's another level that would allow you to do your biometric screening, and that's another $25 cash incentive. Then the third level would be you have to accomplish some certain things to be able to get to the next level, and then on up to the Trailblazer level, which is you would be entered into a raffle for those really nice prizes. And we're going to give away several of those, so it's not just going to be one winner, but there'll be several. And you can see that there will be a raffle for each one of those levels too. So if you accomplish that level, your name will be put in for the raffle, and we'll draw a bunch of prizes out for those levels. So there are 2 components. That you get the cash incentive when you accomplish the biometric screening or the health risk assessment or some of the other things. Then you're entered into the raffle giveaway thing to be able to draw out for one of those prizes. So it's kind of multi-components and lots of incentives and lots of things like Matt said, who would like to make $50 in an hour. That's really basically all it would take to get that done. So I think it's really an exciting program, and we've got a lot to offer everybody to do it. So I just wanted to make sure you understood that a little better.
So the date for launch on this is February 1. The date is yet to be announced on when our wellness bash will be, but our thought is that we will have people here to help those that need help filling out the health assessment, if they need help setting up their actual own profile. And then hopefully we can get the lab involved as well and start maybe do some of the biometric screening that day. But that's kind of all in the works. So there will be more to come, so watch the Friday flyer and emails for that information. This is just some information on how to do it, but we'll get this also sent out in the Friday flyer on how to sign up. But the go date is February 1, and then it'll be ready to go. Once you get to you go back a few slides. Once you get to the main page, you're going to be wanting to look for right here the health assessment. It's just on that left-hand side, and then they're pointing to the incentive tracker that will also be set up. So once February 1 comes, if you want to go in there and set things up, we'll get the sign-up information into the Friday flyer this Friday, so that you can go ahead and do that on Sunday if you choose, and then start exploring everything that they have here. So we'll be available to answer questions. Hopefully we'll know more by then, because we've only been able to have limited access to the site as well, and then we can go from there.
So right now, if you go back to your desks and you jump on the company's homepage, it won't be our SVMC individual account, but you'll be able to check out the company and see their page. But come February 1, as you log in, we have our own special access that will be our individualized account. So yeah, it's really exciting. Yeah, anyone have any
Will
questions?
we just use our regular login access that we use here at the moment?
No, we won't.
It's just a website, so you'll create your own username and password.
Yeah.
Okay.
Good.
There we go.
Thank you, guys. Actually, Matt, you got more guts than I do wearing that treat. But good for you. Let's give him a hand for that. I mean, that's pretty brave. Actually, I'm excited about the wellness program. I think we're definitely on the right track, and we really need to thank we have a committee of several people, and that was volunteers, and a couple were forced onto that committee, I think. Right, Mike? But it sounds like there's a lot of energy behind the committee, and really wants to see this happen and be successful. So we really are putting the resources and the commitment to it to make it a good program. So more to come. All right. Next on the agenda is the Board of Trustees update. We had our board meeting yesterday. Just want you to know that Dr. Dunlap actually sat through the entire meeting. Even the education side. So if any of you guys want to come to a board meeting, I want you to know that it is open to the public. It is open to employees. So if you guys want to come, Dr. Dunlap made it through, so you probably could too. And and actually he actually at the end said he got a lot out of it. He really wanted that perspective. But what was done yesterday? They elected officers. So Rowan Anderson was the of the board, and he's remaining the chair, so he's reelected in that position. Bob Saunders is the new vice chair. Donna Ivy is the new secretary, and Bob Hunsaker is the new treasurer of the board. So that was done, and then they also had their committee assignments assigned to them as well. And really didn't have a lot of action yesterday as far as the board, so it was a lot of stuff as far as updates, where we're going as far as our goals, our strategic plan, giving them an update of where we are, and then we're starting to plan for next year. So we've got next, I guess it's the 1st of March, that we'll be looking at our strategic planning going into the next fiscal year. So time keeps moving fast. And so I don't think there was anything else exciting about the board meeting I need to explain. One thing down on the agenda here, it says under construction, it says Maverick. So this is the last couple days that if you can come up with a name for that building that we purchased south of town, that was previously the Maverick Building. Now the sign is gone, so it's not the Maverick Building anymore. And as of probably next week sometime, we'll find a winner of the naming contest, and we'll change that name, and then we'll erase the Maverick Building from everybody's memories, so it will have a new name. So that will happen, and I guess I'm going to turn it over to Joel. Joel, you're up next. And you got to use this.
Got to use that. Who can tell me anything about the program we have running right now, both internally and in the community, called We Want to Hear From You?
There are boxes.
There are boxes. Who knows where boxes are located? Trent, you hung them up. You know where they're located, don't you? Okay. Chrissy, where's a box located?
By the time clock coming in by the employee entrance.
Okay, employee entrance. I heard another one back here. Care center. Physical therapy building. Sorry, Trevor. By the front door in the main lobby of the hospital. The doctor's sleep room, there's one right next to there. In the Alpine Clinic, Afton Clinic, Thane Clinic, and the Thane Physical Therapy. So we have boxes. There's also one in the orthopedic therapy. So every single clinic, plus 3 of them within the hospital we have, all of them the community have access to, except for the one near the employee entrance. So if you have a patient that has a concern, or better yet, has a praise, they say, hey, you did a great job today, point them towards those boxes. If they don't have time and they're electronically savvy, they also have a QR code that they can take their cell phones and scan, and that'll take them right to the survey online. They can also access it from our home page online. There's just 3 basic questions. What are we doing right? What can we improve on? And anything else you'd like to tell us, okay? What happens is once a month, Pam Wolfley and I go through and clean out all of the boxes, and I type up synopsis for the administration team to take a look at. And then from there, if we get something through the email that does have a return email address, we'll try and answer the question back to them. If it does not, that's fine as well. We are answering some of the questions in the newspaper, in the Star Valley Independent on the back page. If you look at last week's paper, we answered 3 of the questions on there. So just to give you a couple of the highlights, the first 2 months, we had 7 staff members that were recognized as going over and beyond and doing a great job. And so those administrators that oversee those departments are following up with them. Some of the other things that were really nice, thank you for Derek Greenwald becoming the DON on the med-surg floor. Somebody else stated that we're doing great communication with the employees on what's going on with the medical center. Impressed with Dr. Morgan and his assistants and the care that they give the patients. We brought in a great variety of specialty physicians. Some of the areas that they'd like to see us improve on, the patient portal. Somebody said they didn't know they only had 72 hours to access the patient portal. So we're putting together a team, and we're going to revamp that so that we can do some better education. There was a concern that came up here with HIPAA from our staff, that we're out in the community talking about patient information. One of the things that surprised me is I got that. I went to Mike Hunsaker, who is over the HIPAA. I went to Amy, who also helps with that, and I also contacted Dennis Lancaster, who's our legal attorney. None of them have been contacted about any type of HIPAA violations in many, many months. So if you guys are hearing something, you need to talk with those 3 so that we can do an investigation. If you're the one that's breaking the HIPAA regulations, please don't do that. Okay? If you're not aware, they've actually changed the law a little bit, and they can come after you personally, and it's not only a financial fine, but it's also time in jail. So one of the things that also came up, and this came from an employee, there's a concern that we're using the B hallway a lot, going up and down that hallway with the sick patients in there. So we've enclosed, back by Infusion, where we used to walk outside, that's now enclosed. So we're really going to urge people, again, to go out and around. It does take a little bit longer. In the future plans, we had a space planner architect in here last spring. He's actually designed a hallway that we can build from the main part of the hospital into the med-surg area without having to go down and around B hallway. And so that's something we'll look at in the future. A hallway, sorry. I still don't have my A and B's down, sorry about that. So again, this is for internal staff to use, this is for the community, so if anybody out there, wants to use it, please direct them. The QR code shows up on the newspaper, back page of the newspaper, at least once a month. Again, they can go to the website. So please, if you've got people that have great ideas or they want to say thank you to you, encourage them to fill out these questionnaires there. Any questions? It's anonymous. To be honest with you, probably 80% of the emails we get do not have a return email address. Those that do, if it's something that we feel we can reply back to, we will. We're not going to start an argument with somebody if they're like, you charge too much. We're not going to go into a big detail as to how the charges are worked out and they come back and argue again. We're not going to do that, but we're going to try and educate people the best that we can. So, any other questions? All right, thank you.
Okay, Mike. Trevor? Oh, Trevor.
Well, he can wait till
He can
I'm
wait
done.
till Mike.
I'd like to give one more plug to the wellness program. I just want to thank all the committee members. We've got Trevor and Joel and Matt and Sarah and Trevor and Heidi, Dana, and Elisa and others. They're a great group that have really done a lot to put this program together, and I hope that you find it useful, and I hope that it helps you. The organization is spending probably this first year. It's going to be a significant amount of money to encourage everybody to get involved, and we hope that about 50% of our employees will get involved this year. And we're well, Matt's an optimist and I'm a realist. If we can get 50%, it would be great if we could get 100% of you involved. But 50% is our goal, really, and we're hopeful that you'll take advantage of that. I think it'll be very helpful for you and for your family members and your spouse or partners, because it's available to you at no charge. The organization is picking up the tab on this, so I think you're gonna really be pleased with what we have. So take advantage of these flyers that you have. Look those over. Like Matt and Sarah said, we're going to have kind of a kickoff bash. Hopefully before the end of next week, we'll take an afternoon up here in the meeting room and allow you to come up and sign up and get your login and password. And even if you wanted to do we're thinking we might ask the lab if they could help us do the biometric screenings up here at the same time. So we'll try and do those kinds of things to get you kicked off and earning your cash incentives. So that's just another plug for the wellness program. Construction update. We have scheduled the state Department of Health inspectors the first week of March to do a final inspection on the ER. So hopefully right after that, so that's about 5 weeks away, right after that we'll be moving into the ER and beginning to see patients in the ER. So that's really exciting. I noticed yesterday afternoon the nurse call system is working. You can hear the overhead pages from the hospital down in the new ER. So that's kind of exciting. Just those finishing touches are happening right now, and we're pretty pleased with how it's turned out. The OR, that construction is, of course, we're focusing on getting the ER finished, but the OR is moving along too. Much of the mechanical, plumbing, and heating, and electrical, and those kinds of things are going on in that space right now. Kind of in a holding pattern a little bit until we get into the new ER, then we'll tear the old ER to pieces and start the construction in there. So more to come on that, and we'll be asking each of you for your cooperation and your help as we start the construction in the current hospital. As we start the remodel, it's going to be a little bit painful. So I hope you'll cooperate with us and help us get through that. The Maverick building, as Charlie mentioned, that North Lincoln County Hospital District is the proud owner of the Maverick building. It's a near 10,000 square foot office building, pretty much finished on both floors. We are planning to move approximately 25 staff members over there. one of the exciting things about that is here at the hospital, there's 25 parking spaces that are getting freed up. I like that. Yeah, so we'll be moving people over there. Hopefully during the month of March, we'll start to move some of the staff members from the business office and HR and foundation and accounting over there and get them all set up and putting fiber optic cable into the building, and the utility companies have been very cooperative to help us get in there in the middle of the winter, and so that's an exciting thing. So more to come on the Maverick building. I think that it is going to be really beneficial for our organization to have that additional space. Leighton?
I just want to let everybody know there is a donation in administration for a hot dog roller grill. We won't have the cafeteria over there, so we need a hot dog roller grill.
That's our health and wellness.
This is gonna
They can be
prove-
turkey
Well,
dogs.
yeah, Leighton will have to keep turkey dogs over there, right? Yeah. Okay, that's all I had. Any questions about the construction or anything, or the wellness program I could try and answer? Yes.
Are we planning on doing an open house for
We are, yes. I think the last few days of February, we'll take 2 or 3 days and have afternoon tours for the public, and a couple of evenings that we'll have open for the public to tour and take some groups of people through there. So you'll see more of that in the newspaper toward the end of February. Okay? Thanks, everyone.
I just realized I was skipped over by 2 people.
I thought they were saving the best for last.
All right, thanks, Joel. I give up. How many of you are aware of the internet access for staff through Meditech? IT, a couple of you up here. Okay. Let me just tell you a little bit more about this. This is through Meditech, and through the internet access for staff, you can change a few different things on your employee profile. So if you want to change your address or your phone numbers or contact information or any of that, you can do it through this portal. Mindy sent out a link a couple of weeks ago, so it should be in your email. I'll plan on sending it out again today. But we do want you to utilize this for any changes that you have. Just be aware that if you go in there, it'll show that you can change like your W-4 exemptions. Make sure that you can do that there, but the only way it's going to get changed is if you actually come in and fill out a new W-4 with Mindy. So let me just log in here real quick. So it'll pop up and you'll just use your regular username for your computer. And then once you get in, you'll want to click on the employee. And from here you can change your information. So if you go to My Info, you can see all of your information. And as you go down through it, you'll be able to change it. And then when you hit Change My Information, and then hit submit, it'll make that change. It'll submit that change to HR, and then HR will look at it and say, okay, yeah, that's legitimate or whatever, and then they'll change it. So you can also see from here, you can see your benefits, so you can see how much PTO, short-term sick, long-term sick you have. You can see your pay history, so you can see all of your current pay. You can see your I won't click on that one. So anyway,
Transparent organization.
yeah, okay, all right. So anyway, it's kind of a nice way that you can have access to your pay stubs, any of those things. So you won't need to come to us anymore and ask us for pay stubs because you have it all right here. So plus it's all emailed out to you. Your pay stubs are. So it's just a nice little thing through Meditech. The internal jobs, just to note, that's not currently working, so we're still working on that, and hopefully we'll have that to where it can work. Meditech has some things they need to change on it. So, any questions about the internet access for staff?
It's available from your homes too. That link works when you're at your house. So you don't have to be at work to get to it.
I think you can go in and ask for vacation, but you still need to talk to your director. I wouldn't use this for a while to request vacation.
Right. And then the next thing is we're making some pretty major changes in HR as far as the time clocks go. We're going to have all new time clocks, and we're going to get rid of all the paper. So it's going to be very important that you attend the upcoming trainings. We'll keep you informed on when those are coming up. But tomorrow, Mindy and Leighton and I have a super user training, and then we'll do a training for the staff. And then once we have information in the timekeeper system, we'll do a training for the management. And it's all going to be online, so you'll submit your time online. Your supervisor will submit it online, so there's no more paper. So that's going to be effective hopefully March 1st, as long as everything goes well. And we'll keep you posted on more information with that. One of the changes with that is you're going to need an access badge that has the chip inside it. And so we are working with employees right now to get those out. If you haven't been into HR, come in and see us and we'll get you a new badge with the chip in it. One quick and easy way to tell is if you have a chip on the side of it, it'll say HID and it'll have some numbers down the side of it. Those badges have the chip. If you don't have that on the side of your badge, you don't have a chipped badge. So, Mindy, anything else I need to share with that?
If you have a really old name badge, we will need your picture.
Yeah.
And the new badges, since they do have a chip, they do cost more. There is a $5 replacement fee if they're broken or lost.
Yeah, so don't use them as window scrapers anymore.
Hot dog roller fund? Who's gonna get that hot dog roller one way or another?
Make that a $10 replacement charge.
Will we be able to still log in and out from our desk on the computer?
Yes, we'll set it up to where certain staff will have access to do that. And then we'll also have the time clocks. The time clocks are going to be really nice. It'll be a lot easier for nurses to be able to float. So if they're working in med-surg and they have to run down to ER, it'll be a lot easier for them to adjust that. So the time clocks will be very helpful in this. And this is a pretty neat system that we're going to use. So it's specifically for hospitals. They only have one other group that uses them, and it's a winery. So hospitals and wineries, who knows?
There's only 4 kiosks. Same as what you're doing now. So, like for us, at least I split my time up on my time card at the end. So how's that gonna work? Are we gonna be able to adjust that?
You'll still be able to make adjustments. You'll have to work closely with your supervisor, though. No more coming into HR and requesting changes through HR, because we're just going to refer you back to your director.
I just mean, like, we split our time up between, like, med-surg and OB and nursery if we're on the floor, so how does that work?
That's the voting.
We're going to have a training for all of the
It
employees.
won't have to be done in real time, is my question.
If you can't do it in real time, there is a way to go back and adjust that, but it's gonna, like I said, you have to work closely with the supervisor to be able to do that. So we'll have trainings for everybody, and I really encourage you to come to the training because that's how you're going to know how to use it. Otherwise, you're going to be in the dark for a while, and it's your pay. We want to make sure you get paid accurately and correctly. So it's going to be really important to attend those trainings.
Are they putting one of those at the new building?
We have 4 currently, and we don't have one for the Maverick building yet. That's something I need to work through with Charlie and see if we can get one for over there. If we can't get one, we still have access to use the computers, and the computers are exactly the same. The kiosk looks the same as the computer, so there's really no difference. It's just a matter of convenience. I know it's easier to come in and use a clock versus sitting down at your desk and logging in and all that before you're able to clock in. So, any other questions? Okay, thanks. I think that's all I had. Oh, Mars. Mars training. Mars training is coming up, and it's on the starts the 25th and goes until the 3rd. And if you haven't been through Mars before, this is it's a mandatory annual review series for all of the mandatory trainings that we require. So make sure you come up sometime during that week. We'll have it set up just like in past years here in the Grays River Room and Salt River Room. You'll just come through, do the quiz, submit it, and we'll be done. So make sure you do that. It's a lot easier to just do it up here than to have us try to track you down and get it later. So. Okay. The best.
Sorry, Trevor. Okay, I just wanted to give you a mid-year financial update. December was halfway through our fiscal year. And actually, December was our record month for Star Valley Medical Center. It's the first time we've ever went over $4 million in gross revenues, and we actually hit $4.4 million in gross revenues, and all of you probably felt it as you worked hard in the month of December. And the month of December helped us get back on budget also. Our net income for the half of the year is $885,000, and we had budgeted $840,000. So it got us back on track with our budget. Some of the statistics you might find of interest, this is comparing July through December of 2014 through July and December of 2013. Our surgery minutes, monthly average, went from 8,200 a month to 9,400 a month in our current fiscal year time frame. Outpatient visits went from 2,200 a month to 2,800 a month. Lab tests went from 3,800 to 4,200. Radiology procedures, 860 to 950. Our MRI scans, a year ago we did 62 a month, and now we're doing 87 on average a month in these first 6 months. And clinic visits, we were doing 2,300 a month, and now we're averaging 2,400 a month. And our full-time equivalents, which we take total hours and divide it by 2,080 to kind of give you an idea how many employees we have. Last year in 2013 we were at 204, and now we're at 216. So those are just some brief statistics. We appreciate all your hard work. I know December was a rough month, but you helped get ourselves back on target with our budget and making the medical center very strong financially, and we appreciate that.
Okay, thanks, Chad. All right, this is your time. Any questions you have for us? Comments from anybody? It's your time. Nobody?
I have a comment.
Yeah, okay, go ahead.
I see that we have a lot of websites that the employees need to go on. Maybe there's something we need to do that the employees could go to one website and then click on the different websites they want to go in.
Okay.
We have wellness, we have plan source, which those are benefits, we have NBS, it's our HRA card.
Eli, are you listening to this?
I'm listening, I'm just hoping administration's listening.
I think it's an IT issue, isn't it?
It is, but IT costs money.
That's an idea, because there's so many things the employees need to go in, that if we had it in one spot to go into, that would be nice.
I think it's a great idea, so I think I'll be working with Eli. Okay, we had another question over here. Who was it? Joel.
Over on this table, there's a pink shirt and a pen. They would like for you, if you would like to, wish Stacy the best, go over there and sign that and write a little note on there. So if you got a few minutes, do that. If it's too crowded up here, we'll probably have it down in the administration suite today as well, after the meeting, so you can do it there too.
Great, thank you, Joe. Okay. Anybody else?
We also have a board at MedSurg. The same thing, if you come over to MedSurg, we have a board that people are signing, that we have permanent markers that was all decorated by MedSurg staff for too, so.
Good, excellent, thank you. Okay, Pam.
I asked Kelly to move this to the middle of the table, so you can just take a minute, really quick. Want everyone to sign it, we want it covered in black. Since it's what weekend?
Super Bowl weekend.
Super Bowl weekend. There's a Super Bowl gift bag, and it is for Eileen Johnson.
Yes.
And then there are 2 gift cards today, go to Patty Cerrone and Eli. Thank you.
All right, you guys have a good day. Oh, what you got there?
I
Yeah.
want to say thank you to whoever put the little surprises in the chairs. Thank you. Yeah.